Hello and welcome to part 2. Previously at my audio medical basics, we started anatomy and physiology of the ear, nose, and throat. We finished the ear and started with the nose, and we stopped at the vascular and nerve supply of the nose. So here we continue. So concentrate on the road and let me read the book for you. Vascular and nerve supply of the nose. Both the external and internal carotid arteries supply the nose via their terminal branches. As a guideline, the region above the root of the middle turbinate is supplied by the anterior and posterior ethmoidal arteries, with the remaining areas being supplied by the sphenopalatine, palatine, and labial arteries. So, both the external and internal carotid arteries supply the nose using their terminal branches. And as a guideline, the region above the root of the middle turbinate is supplied by the anterior and posterior ethmoidal arteries. Region above the root of the middle turbinate supplied by the anterior and posterior ethmoidal arteries, with the remaining areas being supplied by the sphenopalatine, palatine, and labial arteries. Got it? Okay. The carotid system anastomosis at the anterior-inferior region of the septum is called Little's area or Kesselbach's plexus. The carotid system anastomosis at the anterior-inferior region of the septum is called Little's area or Kesselbach or Kesselsbach plexus. Okay. Venous drainage of the external nose is of importance as blood can drain via the facial and ophthalmic veins to the cavernous sinus. Therefore, a superficial infection of the nasal lining may involve the cavernous sinus. So, venous drainage of the external nose via the facial and ophthalmic veins to the cavernous sinus. Okay? Facial and ophthalmic veins to the cavernous sinus. The main sensory supply is via the maxillary division of the trigeminal nerve. The maxillary division of the trigeminal nerve. Secretory glands are under the control of the autonomic nervous system in the median nerve. The nasal vascular supply is constricted by sympathetic nerve stimulation and dilated by parasympathetic. So, the main sensory supply is through the maxillary division of the trigeminal nerve. Maxillary division of the trigeminal nerve, the main sensory supply of the nose. Secretory glands are under the control of the autonomic nervous system in the median nerve. Okay, and now we'll move to the anatomy of the paranasal sinuses. The paranasal sinuses. The paranasal sinuses are really extensions of the nasal cavity as air-filled spaces into the skull bones. Although paired anatomically, from a physiological view, they should be grouped as anterior and posterior. So, pathophysiologically, the nasal sinuses are grouped as anterior and posterior. The anterior group is the frontal, anterior ethmoidal, and maxillary sinuses. So that's the anterior group. And they drain into the middle meatus. So the anterior group, anterior ethmoidal, frontal, maxillary sinuses, they drain into the middle meatus. The posterior group, which is the posterior ethmoidal and sphenoidal sinuses. They drain into the superior meatus and sphenoethmoidal recess. So that is the posterior group. The posterior group is posterior ethmoidal and sphenoid sinuses, and they drain into the superior meatus and sphenoethmoidal recess. The crucial drainage area of the anterior group of the paranasal sinuses is called osteomeatal complex. And the nasolacrimal duct opens into the anterior part of the inferior meatus. Okay, so we have two groups, anterior group and posterior group of sinuses. The anterior group are the frontal, anterior ethmoidal, and maxillary sinuses. They drain into the middle meatus, and the crucial drainage area of this anterior group of paranasal sinuses is called the osteomeatal complex. And we have the posterior group, which is only the sphenoid and posterior ethmoidal sinuses, and they drain into the superior meatus and sphenoethmoidal recess. Don't forget the nasolacrimal duct opens into the anterior part of the inferior meatus. Where does the nasolacrimal duct opens? It opens at the anterior part of the inferior meatus. Frontal sinus. The frontal sinus is not present at birth, but when fully developed may be extensively pneumatized. Its important boundaries are the orbit and anterior cranial fossa. It drains via the region of the ethmoidal osteomeatal complex before entering the nasal cavity. The frontal sinus. We spoke of drainage earlier, so never mind. The maxillary sinus. Present at birth, it continues to grow until the early part of the third decade. Anatomical landmarks to be noted include the close relationship of the orbit, teeth, nasal cavity, and cheek. These sites can be affected by pathology in the maxillary sinus and vice versa. Okay, ethmoid sinus. The ethmoid sinus describe a labyrinth of air-filled cavities located in the superior and lateral part of the nose, rather like a honeycomb. The walls are very thin, thus allowing easy spread of infection and tumor to adjacent structures such as the orbit through the lamina papyracea and the anterior cranial fossa via the cribriform plate. And finally, the sphenoid sinus. Rapid development of the sphenoid sinus occurs at puberty. The main significance of this sinus is the important structures adjacent, including the internal carotid artery, optic nerve, and cavernous sinus. The cavernous sinus contains the oculomotor, trochlear, and abducent nerves, as well as the first and second division of the trigeminal nerve. The pituitary fossa lies posteriorly. The sphenoid sinus is divided by a septum. The pituitary fossa lies posteriorly. The sphenoid sinus is divided by a septum. Okay, so that's all about the paranasal sinuses. So we can do the anatomy and physiology of the throat in the next video. Alrighty, thank you so much for watching, and stay tuned for the next video. Please tell me if these are so long or so short. Thank you.